is anywhere where there's any attention to decontamination in the nose and the mouth with direct virucidal therapy. There's been stunning results. There's now over 9 clinical studies, one really key randomized controlled trial that's come out of Bangladesh. Chowdhury is the first author, recognizing the fact that the virus is in the air. People breathe it in, it settles in the nose, and it begins to replicate. And it has to get to a certain threshold and overcome the other organisms in the nose and overcome our own immune system to become a clinical infection. So there's about a 3 to 5 day window to actually zap the virus directly. And while the entire world has been focusing on masks, which can't stop the organism from coming in, typical mask, by the way, mask expert Mr. Petty estimates as an engineer that 18% of the air goes around the mask. So it's obvious, no matter how good the mask is, the air goes around it. It's not going to work. Not only that, the virus is too small for the masks to filter out. But while the focus has been publicly on masks, or even more inanely on hand sanitizer. You know, people are there's hand sanitizer everywhere in the airport. I'll fly home and people are using hand as if it's spread by the hand. It's spread in the air. The hands have nothing to do with it. The hands have nothing to do with it. So there's been this illogical, unsupported use of the one thing that hand sanitizer have taught us is almost anything kills the virus, and the same thing is true in the nose. Almost anything kills in the virus. In the Chowdhury protocol, they use dilute povidone iodine, which ophthalmologists use this. It's called betadine. They use it in a dilute form for eye drops, so it works as an anti-infective. Ophthalmologists use this years ago. Sinus doctors have used it to treat sinusitis for years. Dentists have used dilute povidone iodine. They've used dilute hydrogen peroxide. Dentists have actually used dilute sodium hypochlorite or dilute bleach. Just a few drops in some water and gargle and spit it to actually kill other viruses that cause gingivitis, Epstein-Barr and cytomegalovirus. So there's a whole literature of direct virucidal therapy for the nose and mouth. Well, Chowdhury applied it in this randomized trial of 606 individuals, and it was stunning. It dropped the PCR positivity rate. It just crashed it after 3 days, markedly reduced any chances of being hospitalized or worse. They literally shut the virus off in the nose. And the results were stunning. It became available early in 2021. Doctors started to adopt it. We started communicating with dentists. We started making handouts, putting it into our patient guide. And to this day, the lead approach to COVID-19 is get going by taking dilute povidone iodine. We're talking about half a teaspoon in a shot glass of 1.5 cc's of water, taking a bulb syringe over the sink, squirt it up in the nose, sniff it back, spit it out, do that twice, gargle with the rest, and you basically are done. Done. You can do that twice a day preventively. I tell patients you go out to church or congregate settings, you're still susceptible, do that as a part of hygiene. Patients' chronic sinus infections get better with this. They breathe better, and they markedly reduce their risk of developing COVID-19, supported by multiple studies. And then in acute treatment, we do what Chowdhury does every 4 hours. And it's amazing we can take what's going to be a potentially severe illness and make it a mild illness. Now, I personally had COVID-19 in 2020. So before this research was done, I had no knowledge of using local virucidal therapy. And I can tell you, I remember day by day feeling the virus in my nose and sinuses multiply, headache, fever, congestion. And it was obvious that's where the problem was. And then it invaded my lungs. Then it makes perfect sense. I could have zapped it there and given myself a milder illness. So we're capitalizing on one message that could come out of this. This is available, freely available all over the world. A bottle of povidone iodine, 10% povidone iodine, costs between $5 and $10 in any online store. It's widely available. Every household should have it. Only those with hyperfunctioning thyroid problems, which are rare, or those who have an iodine allergy could go to a backup, which would be dilute hydrogen peroxide.